Here's an example of the hardening part, and it's not giving at all. And the blood vessels are trying to go through. I'm sorry, that's the plaque buildup. I apologize. The plaque buildup causes a clot. The clot blocks the pathway, slows down stuff trying to get through, puts pressure on the other parts, and then over time, that pressure can cause more tissue to get more resilient to coming back and forth, relaxing, contracting like it's supposed to. It takes the elasticity out of it, and then you have the problems. If this rupture happens in the brain, you have an aneurysm, you have a stroke. If it happens in the heart, you have a heart attack. If it happens in the lower extremities or in any of the blood vessels leading to some of the organs, like here's the kidney, and this is the blood vessel. The red is the one coming from the heart. Blue is going back to the heart. If it happens in this red one coming from the heart, then if this rupture happens here, you have bleeding. That's the blood's going everywhere instead of to the tissue. The tissue dies. The kidney fails, or whatever the organ is, it fails, and then you have an issue, and that comes from hemorrhaging. The pressure down at the legs is not as great as the pressure is up here. So you have a greater chance of the problems happening up here than you do down here. The blood vessel going up to the brain is wider than these blood vessels down here. And so there's a greater chance of the damage happening up here or in the torso area. And this problem, you can operate with one kidney. You can't operate with a missing brain. When you lose your brain, not parts of it, just when you lose the whole brain, that's it. They can't redo brain replacements. So that's not a possibility. Oh, the eyes. People say, oh, wait, come back here. People who have blood pressure issues, the doctors will examine them over and over again. Follow up with them. Have them go see an ophthalmologist to look at their eyes. Sometimes you can notice a blood pressure problem even before the pressure shows up on the scope by looking at the person's eyes. This is called, this part right here, this is the optic nerve. This is the part that actually goes to the brain and connects to the brain so that you can pick up the signals that came into the eye. This is the front of the eye. Light comes in, it brings the image in. There's a series of nerves that lines the eye all around here. What allows us to see color and size? Those nerves are here. What allows us to actually see the image itself? Those nerves are back here. There are blood vessels that branch out. There's like a major blood vessel that comes into the eye. Then there are blood vessels that branch out to feed the eyes, all these nerves and the cells lining the eye, to feed all of this with oxygen, nutrients, take the waste away. When a person has high blood pressure in the eye, these blood pressures, because of the blood pressure problem, the vessels are being filled up, the vessels can't handle the pressure, and so they start to relax too much, and then they start to swell. And so you wind up seeing swelling of the blood vessels. So when the doctor looks in, they can actually see these blood vessels. They look wider than they need to be. They know that this person has a problem. If this is not fixed over time, you can have a rupture in the blood vessel. Just like I said, you get the stroke. You have a rupture in these blood vessels. Blood fills up this cavity. The person knows because they can't see this cloudy. They can't see anything. If that rupture happens and this gets cloudy, the area that's supposed to be getting that blood, because now, like it happens here, none of this is going to have any blood, so all of this is going to suffer, that dies. If you lose nerves here, here, and here, you're blind. And you can't fix that. We don't generate new nerve tissue as fast as we generate other tissues in the body, not nerves. Nerves are the slowest tissues in the bodies to grow. Your brain is half the size it's going to be at birth. Then it's half that size of what it's going to be as you're full grown. Your brain only doubles in size. The bone between knee and ankle, I think it grows 6 times longer than it is at birth. So bone tissue grows really fast, muscle tissue grows really fast, especially when you're young. Nerve tissue doesn't grow that much. And that's why a person with spinal injury, with nerve damage, they pretty much tell that person, we're going to teach you how to use other parts of your body, But this particular part, you're probably not going to get full control over it, or at least that nerve. You're not going to get full control over that nerve. We'll bypass it and do some other stuff. That nerve is damaged to the point of probably not being repaired. And I keep using probably. There's a lot is in control of everything. And who knows? Down the line, it could change. But what scientists know now, nerves don't come back when they're damaged. So if the blood vessel's going to these nerves, here and here, or here, that's the main one, if these blood vessels burst, then that person is going to have some problems with their eyes. And that's from high blood pressure. Diabetes, I said I wasn't going to say anymore. Not going to pick on diabetics today. I refuse to do that. Okay. But it's hard to deal with this without looking at the connection between the disorders. They're not in isolation. I'm treating them in isolation right now, but they do not occur in isolation. One is definitely connected to another. Almost done. So this organ, this organ that we call the heart. I said something about the heart when I was talking about diabetes. I said something about the heart when I was talking about blood pressure. Well, let's look at the heart in isolation. Heart diseases.
Cardiac compromise is a blanket term that refers to many kinds of problems with the heart. Just as there are many problems, there are a wide variety of signs and symptoms associated with these heart problems. As an EMT, it is much safer to treat all patients as though they are having a heart problem,
This
rather
particular
than
video was designed for
diagnose the
people who do
specific disorder.
ambulance care and stuff like that.
With that in mind, let's take a closer look at 5 of the most common heart conditions. Coronary artery disease. Coronary artery disease occurs when the coronary arteries are narrowed or blocked, reducing the amount of oxygen delivered to the heart. 2 conditions, atherosclerosis and arteriosclerosis, commonly cause the narrowing or blockage of arteries. Atherosclerosis is a buildup of fatty deposits on the inner walls of arteries. This buildup causes a narrowing of the inner vessel diameter, restricting blood flow. Fats and other particles combine to form plaque. Arteriosclerosis is a stiffening or hardening of the artery wall resulting from calcium deposits. Often called hardening of the arteries, this condition causes the loss of elasticity, changing blood flow and increasing blood pressure. These conditions can facilitate rough surfaces, making them vulnerable to blockages. A large thrombus can cause an occlusion, or it may break loose to become an embolism and form blockages elsewhere. When blockage occurs, tissues may die, and in certain cases, this can be fatal. Acute myocardial infarction. Acute myocardial infarction occurs when a portion of the myocardium, heart muscle, dies as a result of oxygen starvation. The dead area can no longer pump. This can lead to cardiac arrest, shock, pulmonary edema, or congestive heart failure. In some cases, heart attack patients suffer cardiac rupture as the dead tissue area of the heart muscle bursts open. Medications called thrombolytics dissolve clots that block coronary arteries. Other patients receive an angioplasty, a balloon device, to open the arteries. Aneurysms. Weak spots that dilate are known as aneurysms. When a weakened artery bursts, rapid internal bleeding occurs, and tissues beyond the rupture can be damaged. A rupture of an artery within the brain can result in a severe stroke. If a major artery ruptures, death from shock can occur. Arrhythmia. A malfunction of the heart's electrical system will generally result in an arrhythmia. Electrical disturbances within the heart result in arrhythmias, including bradycardia, abnormally slow, less than 60 beats per minute, tachycardia, greater than 100 beats per minute, or rhythms that are present when there is no pulse, including ventricular fibrillation, ventricular tachycardia, pulseless electrical activity, and asystole. Congestive heart failure, CHF. Congestive heart failure, CHF, is a condition of excessive fluid buildup in the lungs and other organs because of inadequate pumping of the heart or a failure of the lungs to function properly. Congestive heart failure can be caused by diseased heart valves, hypertension, or some form of obstructive pulmonary disease. The symptoms of CHF may include tachycardia, shortness of breath, elevated blood pressure,